I became aware of genetic counseling through my project that I'm working on. I'm writing a one-woman show called, well, actually I don't have a title, but it's a one-woman show starring me about what it's like to live with generalized anxiety disorder. And I'm working with Victoria Maxwell, and she is the bipolar princess, and she talked about genetic counseling in reference to something that I was writing about, and she suggested that I maybe want to call them up myself, and I certainly did. So in fact, through email, I met Emily, who is one of the delightful genetic counselors, and we set up an appointment to talk to me about some of the things that I was wondering about in terms of my writing. Specifically, I wanted to know where, like how it came to be that I have this mental illness, and I wondered, you know, I'm not weak, so why have I succumbed to this? And I wondered, did I do something wrong? Is it something within my family? Is it, to be honest, I had some trauma as a young child, and I wondered, did that trauma cause my mental illness? So these questions that I ran by Victoria, she suggested that genetics counseling would be able to help me figure things out, and that's exactly what happened. Emily and I spoke. She asked me quite a number of questions. Some, funny enough, when we began talking, she said that a lot of the clients that come her way are looking at finding out about kids, and if you're going to have kids, are they going to be prone to disorder? But I'm almost 50. I don't have kids. I'm not going to have kids, so that wasn't my issue at all. So that was one thing that we quickly eliminated, and we were able to spend more time focusing on what my specific questions were, which was really helpful. Because, as I said, I'm almost 50. I have seen 4 therapists over 25 years, so for half my life. Half my life I've been trying to figure out, what did I do wrong? How can I fix this? To find out that there is not only an environmental component, but also a genetic component, changed my life. And when Emily asked me if I'd be willing to do some more work with her and with Janine, I was glad, more than happy to do whatever I can, because that little piece of education, as I said, it changed my life, and it really took the burden off me of feeling like I should have seen this coming, I could have seen this coming, if only I weren't such a worrier, if only I asked my therapist the right questions. So in a very short amount of time, comparatively speaking, I was able to let my shoulders hang. I was able to dive deeper into the writing that I'm doing, because I'm not afraid of feeling like I have to examine the trauma yet again, because that's a part of my story. It's not really a part of my story. The show is about living with generalized anxiety disorder, and I may write a play about that trauma, and I may not, but I felt like I can't be a true artist because I'm not telling my whole story. But part of the piece that I was missing was the genetic factor. So that's how important it is to me to let people have that relief that I had, that I've experienced, because I have no doubt in my mind that there are lots of people like me thinking it's my fault, and it's not.